We first want to make sure that you are an appropriate candidate for hair loss or hair restoration surgery. There are many things that we're going to cover in a consultation. We talk about the progressive nature of hair loss. I like to talk about the art of hair restoration and the design we're going to do for your scalp. This is a permanent procedure, and then we'll talk about your donor area and the potential for scarring. We also like to go over your pre-op requirements, the surgery itself, what's going to transpire when you have the surgery. And then we'll talk about other surgical options, include medical options, non-surgical options. We discuss the side effects or complications that may occur in your treatment plan. We talk about your motivation for therapy because sometimes it's just a situational phenomena that may pass and you may not really want to have the hair restoration surgery. I want to review the surgery in context to your medical history and to what is going on with your scalp. I want to know, how long has this been going on? For most people, they don't start to notice that they've lost their hair until they've lost 50% of their hairs. We start out typically with about 100,000 hairs on our head, and we have to lose 50,000 before we start to notice it. The location is an indicator of what type of hair loss you have as well. There are certain patterns that we see in androgenetic alopecia in men and female pattern hair loss in women. And for men, it's going to be temporal recession as well as loss of hair in the crown. For women, we're going to see diffuse thinning and also loss at the top of the head. Next, we're going to talk about severity. Some people say that they are losing clumps of hair. If you're losing extensive amounts of hair, that might be an indication that you have a reversible cause of hair loss called telogen effluvium. Typically, people are going to lose about 10% of their hairs on average per day. Most people shed about 100 hairs per day. We also want to talk about hair care, things such as colors, perms, relaxers, and flat irons. The way people treat their hair can lead to breakage of the hair. And in this situation, it's different than if you have androgenetic alopecia or if you're losing your hair from the root. In this situation, we want to just change your behavior and alter these hair care patterns so that you stop breaking your hair. Next, we want to talk about your past medical history. We want to talk about things such as thyroid disease, recent childbirth, weight loss, poor nutrition, surgery, cancer, or scalp inflammation. Scalp inflammation can be the result of things such as seborrheic dermatitis, commonly known as dandruff, or things such as lupus. Now, all of these things in your past medical history may contribute to hair loss, and we may be able to just alter this, correct these problems, and then you won't have the problem with hair loss anymore. Family history is important because androgenetic alopecia comes from both sides of the family, so the more people in your family that have hair loss, the higher risk you have for losing your hair. We also want to review your medications, and there are many medications that may contribute to hair loss. This list of medications is extensive. It includes acne medications, particularly Accutane, which is a vitamin A derivative. We also have blood thinners, and many people are on Coumadin or heparin, and this can contribute to hair loss. Anti-cholesterol medications can contribute, as well as anti-convulsants. Other medications that can contribute to hair loss include antidepressants, diet pills such as amphetamines, antifungals, medications for glaucoma, including beta blockers, medications for heart, which include antihypertensives as well as congestive heart failure medications. Beta blockers in particular contribute to hair loss. Medications for hormonal conditions such as birth control pills, hormone replacement therapy for women. Some men will be on testosterone or anabolic steroids, and prednisone and other steroids can contribute. Anti-inflammatory drugs such as non-steroidal anti-inflammatories. This class of drugs includes Motrin, Aleve, that sort of thing. Drugs for Parkinson's disease, drugs for thyroid disease, and drugs that treat ulcers. For those of you who are interested in hair restoration surgery, I highly encourage you to come in for a consultation to one of our locations. We have offices in Newport Beach, Rancho Mirage, and Palm Springs. We also are happy to do online consultations as well as telephone consultations. Please visit us at www.contourderm.com.